Welcome back. Today we are checking in with the Kentucky Medical Research Center to find out about their latest studies, and we welcome Megan Poole, a clinical research coordinator, with more information. Thank you so much for being with us today.
Well, thank you so much, Christy, for having me. I love to take every opportunity I can to talk about what we do at Kentucky Medical Research Center.
And I know there's always a wide range of things going on, and there are several studies that you're focusing on right now. Tell me about those.
We have a few main studies that we're trying to recruit actively for, and one is for people who are constipated now from using a lot of pain medication. If they have back pain or any kind of pain, and they're taking their medications for that, and now they're constipated from that. We have another study for people who have been diagnosed with major depressive disorder. And we're looking at a medication for that, and maybe these individuals, they're on medications already, and it's helping a little bit, but they're not quite back to where they'd like to be. So we're looking at a medication for that, and also for overactive bladder for men and women who suffer from this and who are at least 65 years of age.
And if those studies may not be something that you would necessarily qualify for, several more upcoming things that you have going on as well.
We do. We have a study starting for COPD, for rheumatoid arthritis, for lupus, also for constipation not related to pain medication, gout, diabetes.
All some common problems that folks may be dealing with. Now, what's important to mention, as you said earlier, for example, one study may be dealing with constipation related to medications, but it's best to kind of get more information to find out if you may qualify for one of these.
Absolutely. If you're interested, if anyone is interested in participating in research, then they should definitely call us, especially if they have any of the conditions that I'm talking about now. But especially just call us, and there are qualifications to see if someone might qualify for any of the studies, but we do have a few people on staff that's what they do. They take calls and they talk to people and see if they might qualify, and we'd love to hear from anyone who thinks that they'd like to participate.
And you see there the phone number and website at the bottom of your screen, and you'll find a list again to all these studies that we've mentioned and find out what they have coming up and more information on how you can participate. And there are some real benefits of participating in medical research.
I love medical research because what I tell a lot of my patients is that you're not only helping yourself into getting medical care at no cost, your lab work, physicals. We say it's the only time that the doctor pays you to come see them because we do provide travel stipends. And there are other benefits as well. I like to also tell my patients that you're not only helping yourself, you're helping your children and your grandchildren, because whatever illness that you're suffering from, that you're having problems with, maybe the medication that you're helping to test years down the road, that might help your children and grandchildren if they suffer from this.
Well, that's a great way to look at it and put in perspective the difference that you can make by participating in research like this. Again, you see the phone number and website at the bottom of your screen. If you're interested in learning more, I'm sure Megan and the rest of the staff there would be glad to help you out. Thank you for being with us.
Thank you so much.
We will be right back with a check of a much cooler forecast. Mary Watson has a preview.
Yeah, we're cooling things down. Yesterday we were into the 70s. Today only into the low 40s. Tomorrow, though, it's a tad warmer. I'll detail that full forecast coming right up after the break.